Joining me now from Sao Paulo, Brazil is Lorena Barberia. She's a professor of political science at the University of Sao Paulo. Lorena, South America, we heard our reporter say this, it has 5% of the world's population, but accounts for a quarter of the global death toll from COVID-19. Explain to us, perhaps, what went so horribly wrong?
Well, we have to remember that the situation in Latin America is a population that half of the workforce is informal labor. And so we have very fragile labor markets. The economy is it's very difficult for people to work from home. So it's very difficult, and it's been very difficult. We're nearly 15 months into the pandemic. It's very difficult to implement and hold social distancing policies, rigorous policies in place when so much of the population cannot afford and doesn't work at home.
What about strained and underfunded health systems? Also, misinformation.
Yes, those have been equally important challenges at this moment. But we have to remember in the context, there's a lot of heterogeneity in terms of health systems. We have Brazil, which has a vast, granular public health system, and other countries where the public health system wasn't as strongly invested and developed. So there's very uneven levels of development across the region in terms of the health system. And disinformation and politicization of the virus has also been really important. In the case of Brazil, for example, the president and much of his supporters have been very much at the forefront of negating the importance and the seriousness of the pandemic, and even questioning the efficacy and how safe vaccines are. So there's been a lot of politicization that has also affected behavior and understanding of how the virus is spread.
Where do things stand, Lorena, in Brazil, where you are, with this new variant that first surfaced there?
Well, I wish we have to remember the variant we're talking about is only one of many that is circulating in Brazil and that we're monitoring. And there's a variant that was detected in Manaus, which quickly grew to dominate most of the country and most of the states. In the few cases in which there's genomic sequencing that's being done, we're detecting that variant that was once dominant, what we know is there's other competing variants that are also in circulation, and we really depend on having strong surveillance to be monitoring what's happening. But we know that all of the major variants that are in circulation in the world that are of concern, all of those variants are circulating in Brazil.
Let me move on to Cuba, which had done relatively well. Cases are going up again, but some encouraging news on their hometown vaccine, which Cuba says is 92% effective. So they clearly did something right.
I think that Cuba is a very interesting case. We have to remember that Cuba also isn't betting on only one vaccine. There's 5 different vaccines that are under study. But yes, it shows that if we implement, I think the Cuban case is an interesting case of showing we have very fragile labor markets, very fragile economies, but if we have coherent policies, even within that context, they can make a difference. And vaccination isn't enough. We need to have a coherence across the entire strategy that's being pursued in order to really effectively control the cases and the number of deaths.
Such an important point there. Lorena Barberia, thank you very much.